Assalamu alaikum. Peace be with you. This is Imam Malik Mujahid, and you're watching rather, to Mujahid Talks. And I'm not the only one who talk. There are other people who do. And this is what we have at Muslim Network Television. Muslim Network Television is the only television network launched by the Muslim community. It is on Galaxy 19, a satellite. If you have satellite dish, you can directly take there. More information available on muslimnetwork.tv. And we are on Amazon Fire and Roku and YouTube and Facebook. And in a week, we'll be on Apple TV as well. So thank you and welcome watching. And you can use Facebook comments and you can ask questions and we will be able to read those questions and get you the answers. We have an amazing guest today, Dr. Uzma Sayed. Dr. Uzma Sayed is a New York-based disease specialist. Welcome to Muslim TV Network.
Thank you so much for having me.
Thank you. Now, Dr. Uzma Sayed is an amazing power woman, what people call superwoman. She is not only a physician, she goes to 3 hospitals, spend almost 16 hours a day while she has 2 young children. She's also, and she has to do that in this environment that since she's a specialist in infection prevention, and she's on committees and Long Island task forces to deal with this pandemic. And at the top of it, she takes her specialty to not only medical residents to teach them and prepare more physicians to become expert in this field, but also she teaches at medical school, colleges, and high schools about this particular profession. So welcome to Muslim Television Network.
Thank you so much.
Yes. Dr. Uzma Sayed, you are dealing right now in hospitals with patients who not only have heard all the challenges around, but are personally suffering through that. And does it become easy when you have dealt with one and the second one, or it continues to be? I know physicians see human beings in difficulty all the time because that's their job to save lives. But tell me about what is the pandemic situation, how you're dealing with patients.
Yeah, absolutely. That's a great question. It is really challenging. As you mentioned, physicians, we are trained and used to dealing with difficult situations. We are very resilient. We know how to operate under pressure. And we see a lot of illness and mortality and patients that are critically ill. But what we haven't dealt with before is this kind of pandemic situation where the volume of people coming in with acutely ill, situations and illnesses where they are requiring hospitalization, requiring intensive care unit stay, requiring ventilators, and the speed at which and the volume with which that these patients are coming in, and the amount of mortality that we are seeing in a very small amount of time. That's something that we have never really seen before. Most of us, given that the last pandemic was over 100 years ago. And that's something that our healthcare systems haven't really dealt with before, and it's been really challenging because as healthcare workers, we are used to nursing people back to their health. We're used to curing people. We have people that live in their 80s, 90s, come into the hospital, get better, and then go home, go to rehabs, nursing homes, wherever they go, but they go on to live. And in this kind of situation, we're dealing with people that are generally healthy, that may not have underlying medical conditions, and certainly those that do have underlying conditions and that are elderly, coming in acutely ill, requiring, hospitalization, ventilators, and unfortunately, succumbing to this illness. And it's been really challenging. And although, on one hand, you can say that it gets, easier with time. As you get used to it, you never really get used to losing a patient that you feel helpless about, that you don't have a cure for, that you don't have a prevention for, with this novel virus that we're dealing with.
Do you remember any patient in particular, without giving the name, which comes to your mind?
Yeah, I wish I could say it's just one. There are so many of them, unfortunately, that have just been so helpless. A lot of times these patients come in, gasping for air. They feel like they can't breathe, and they a lot of times they describe it as that they feel like they're drowning. They have something sitting on their chest, and you can see the fear in their eyes, and you can see the anxiety, you can see the loneliness. They're not able to have family members with them, and it's really very, very challenging. I've had several patients say to me, don't put me on the ventilator, and then ask minute they've changed their minds because there was no alternative. I've had patients before going on the ventilator say, I want to live. And these things have just been heartbreaking, to watch and to experience and to live through, because you want to help them, and we're doing everything that we possibly can. But the way that it stands right now, there's some people that get better, and unfortunately there's some that succumb to this.
So, person saying, "I want to live," he has desire to live. So, as relatives cannot come, as probably the counselors cannot come, so do the physicians have to become more showing more empathy? Do they find some time to say a few words to them?
Absolutely. So that's really what's happened now, where we do try to modify this and do it as best as we can with the use of technology, FaceTiming family members, and trying to have the patients feel connected. But more often than not, what happens is physicians, nurses, physicians assistants, anybody in the healthcare environment ends up being that person to provide the emotional support that the patients need. And whatever it takes to help them through this process, we've been all doing whatever we can to the best of our abilities.
You mentioned ventilators, and there was a big thing that there are not enough ventilators available. I have one person uh, who passed away, and when I spoke to the family that about the medical help, they say we tried multiple times to call or take him, and they say, "Oh, don't come. Come at a time when you cannot, when you have difficulty breathing." And once he arrived, he was put on ventilator just for a day before he was taken for burial. So has the situation of ventilators improved somewhat?
Yeah, so that was really a concern early on as we were getting into the start of the epidemic, the pandemic in the US, and especially in New York, given that we're the epicenter, was how the healthcare systems would be able to handle it. And given that the population of the country and the population of New York, and just supply and demand issues that we had, that the healthcare systems were on the trajectory to be overwhelmed and to have the lack of resources. Certainly that has improved with time. Once the Defense Act was activated, there was a lot of supplies that were then available to healthcare systems, and this has improved, throughout the country. But I think initially, we're learning so much about this virus every day. There's something new that comes out. A lot of the data that we had early on was what we were relying on globally from, the countries that had, cases before us. And every day we learn something new about it. And, early on, we didn't even know about the asymptomatic transmission. And so, as people were having mild illness, majority of people we are still considering will, recover from this and will have mild illness. But and for that reason, people were encouraged to stay home until, they had significant symptoms. But, what we know is that symptoms can progress rather quickly, and it's important that a person is conversing with their medical provider, a healthcare professional, to ascertain whether those symptoms are concerning, requiring, evaluation in the emergency room. Because most people don't have the ability of having their oxygen levels checked at home. And so, there's certain things that really need to be looked at. And for that reason, although, that was a concern before, every single person is entitled to healthcare and to treatment. And that really needs to be the focus.
So while physicians themselves are taking substantial risk, and you being a physician, you being a mother, you being in 3 hospitals, what are the things which occur to you? I mean, do you think of reducing the work hour? Do you have a choice of just going to hospital 8 hours a day instead of putting 16 hours? What goes on in your mind? What you talk to about that to your children while taking this risk?
Yeah. So that's a great question. So it's very complex, and this scenario is very different for every single person. It's a very individual scenario. So for me, so I took an oath to be a physician. Most people have, and our first duty is to our patients. But also in Islam, there's so much value for a life, and it runs very much parallel to medicine and what we do. So we can't really have that sense of abandonment. Although the scenario is scary, all of us have felt that fear. Everybody in healthcare has felt scared because we're not used to being in a scenario. As an infectious disease physician, we are always the first to be called whenever there's anything alarming, any communicable disease. We dealt with this with Ebola, we dealt with this with Zika, with, all tropical illnesses that we see all the time. But we're dealing with a very, very novel virus that is so communicable, so transmissible, to the fact where people don't have any symptoms and it can transmit this disease. And having that constant exposure at work obviously is putting us at more risk. And I think, there was a lot of anxiety for healthcare workers right at the very beginning, especially because we still didn't have all the answers. People didn't know exactly how the transmission was. What is putting you at more risk? Is certain protective equipment sufficient? All these variables, all these unknown questions, answers questions that we didn't have answers to, really confounded all of that anxiety for a lot of healthcare workers. And personally, having children at home, having my husband and family members, elderly parents, there was a lot of decisions that I had to make, very quickly. My parents were initially helping out, babysitting, watching, my younger son while our nanny was out because schools were closed. But as our cases started growing, I had decided then to send them to their house because it was too risky of a situation for them, because I was exposed so much with the volume of patients that were coming in. So we quickly had to modify that. Then came, protecting your loved ones in your own household, your children, your husband. The decisions were very, very difficult. I have a lot of healthcare friends, physicians who decided to move out of their homes. Not everybody can do that. Not everybody has the luxury of doing that. Some people are the sole providers. Some people, whatever family dynamics there may be, they don't have the luxury of doing that. I have people that have moved into separate rooms, so I follow a very stringent decontamination protocol where, before even entering the house, everything from the hospital, we do proper care in the hospital as well to not bring anything home, but additional precautions are taken before entering the house to make sure I limit the amount of exposure. I've had to have some distance, from my kids for a while, but, knowing that this pandemic is something here for the long run and not, something that we're dealing with for 2-3 weeks, it's essentially, impossible to be away from your children and your spouse for an indefinite amount of time. So you have to, really make a personal decision, and you have to see what's the best way that you can operate to mitigate and limit the amount of exposure that you can have to family members. And oftentimes, this may include masking while you're in the house, obviously hand washing frequently, and the common use areas, wiping down all the surfaces to really prevent, any spread, because, people may be asymptomatic and transmitting it. But that being said, it's a very difficult situation to be in, and all of us do our best on a daily basis to get through it one day at a time.
Well, one thing which you miss at the top of it, it is Ramadan.
Absolutely.
So, so what your youngest child tells you?
So he's, it's been a very different experience this Ramadan for all of us, throughout the world, not just within the US. But so usually we have certain routines and rituals that I'm sure a lot of families do. But Ramadan is all about family time. And, three households in my family get together: my sister's family, my parents, and all of us. And, we have iftar together. My parents are usually in the house reading Quran while we're doing the prep work for iftar. We pray together. We, do the dhikr together. We, share stories. We talk about, world events, and all of those. And this is 1 month out of the year that, it's like clockwork. Everybody, there's a certain scenario routine that happens every day. And my youngest, my son, he, looks forward to this, just like the rest of us. And, he was, setting the table the first day and started setting the table for all family members. And I had to sort of remind him that, okay, it's only going to be the four of us. And, there was this sadness in his eyes, and, he started putting away the plates, but, he's also adjusting. It's an adjustment for everybody that this is our new normal. So we did the next best thing, and we did, a FaceTime session, a Google Duo session with my parents and then sister, and, tried to connect as best as we could given the situation.
Now, getting back to hospitals, uh, are hospital developing system and processes which will help us, as people are saying that it may last a year or 2 years? So are system and processes improving at the same time, or people are just haphazardly dealing what is in front of them?
Yeah, no, so there's a huge learning curve, and so I've been leading my hospital and health system with the task force in preparation. So as infectious disease physician, we've been really tuned into this since December. I started sharing with the community about the first reports out of China, and all of us have had sort of butterflies in our stomachs, as infectious disease physicians, because we knew it was coming. So from January, I was very proactive about trying to get the hospital prepared for what was coming. And, we had a lot of meetings, a lot of preparation, and a lot of contingency plans. And because of that, we were able to deal with the volume and what came our way. But no matter how much you prepare, there's nothing that can really prepare you for something of this, caliber and this extent. But even, given how much burden we had of illness and how many people are affected in New York, for the most part, we were able to still, adequately provide care for everybody with adequate protection, and have a system in place for staff and physicians and nurses. Now we're moving into a transition phase where, with sheltering in place and New York, on pause, we've had a significant ease on the number of patients coming into the hospitals with COVID-19. We still have a good amount of patients that are in the hospital from several weeks ago. This illness is like no other. People get sick, and they can be sick for weeks and weeks and weeks. So we still have patients in our intensive care units with COVID-19, and we still have patients on our medical and surgical floors with COVID-19. But the number of new patients coming into the ERs, that has dropped significantly. So what that allows us to do now is to plan for phase two, which is, now we're going to start seeing, which we already have, the patients coming in who don't have COVID, who have other medical conditions that have essentially been waiting for things to settle down. So now we have to make sure that we have areas in the hospital that are separated so that we can continue to take care of COVID patients and non-COVID patients. And then we're transitioning and thinking about, as we go into having more return to somewhat normalcy or a new normal, how to care for patients that may require surgical procedures, and how to care for them as they stay in the hospital, and proper infection prevention measures to make sure that everybody that comes to the hospital stays healthy and safe and leaves without any issues.
As you know, initially people, even now, there are a lot of complaints by nurses and physicians that there are not enough protective equipment available. Our sister organization, Justice for All, actually launched a campaign to push for that. So, has that situation improved somewhat?
We've definitely seen improvements with all of the outpouring of support, whether it be at the national, state, or local level. And mostly, we've seen so much support from community level, such as your organizations and other large organizations really rallying together and raising funds and donating PPEs to healthcare systems. We've got a nice stockpile, but the concern is, the volume again. So it's good to have, and now many states, including New York State, has required that as hospitals move forward with these transition periods, that we have a stockpile enough to prepare us in case there's another surge, which there is a chance, obviously, that can happen. That we have adequate supply, so we don't run into that situation where things are running out and it's an emergent, chaotic, and dangerous situation. So it definitely has gotten better, and everybody's trying to prepare for a best case scenario.
Okay. Prepare for the best case scenario, or prepare, I think they should prepare worst case scenario as
Yeah.
well.
Well, absolutely. So worst case scenario with the best preparation possible.
Okay. So what is the worst case scenario at this moment? Because you're chairing the task
Yeah.
force on this in Long Island, New York,
Yeah.
and there is a tension between politicians and scientists. So share with us what our audience need to know.
Sure.
I mean, you're at this moment at the Muslim Network Television, which goes to Galaxy 19 satellite to all over United States, Canada, as well as Mexico. And people have high level of anxiety, and they don't know what to believe and what to trust. And there are, our country is a mixed of amazing number of people. Almost 30% people don't believe that America landed on moon either. So in that particular environment, uh, what as a scientist, as a person who teaches infectious diseases, and as a person who is chairing a task force in a major part of New York, what would you like to share with our audience?
So I think it's really challenging for most people because of the volume of information that's out there. What I would really urge people to do is to really always question the source of the information that you're getting. It's very easy these days because we are so connected with technology for information to be available at your fingertips. Whether it's social media, text messages, phone calls, things are being communicated regularly. And with the current pandemic, there is so much information out there that you don't know, like you said, what to believe. And I think you really have to rely on a credible source. And if anything comes across, and you're not really sure, ask somebody who may have the answer to that. So I would say definitely follow, the authorities, WHO, CDC, Infectious Disease Society of America. And, there are unfortunately a lot of conspiracy theories out there, for people across the US, North America, Canada, throughout the world, to really know the important message is that, this is real. Being in New York, being on the front lines, having seen, hundreds of patients with COVID that are not doing well in the hospitals, I can tell you firsthand that this is not something that's been exaggerated. I know it's in the media a lot, and I know this is a hot topic, and so sometimes people feel overwhelmed with the amount of information that's coming out. And there's been a lot of videos, circulating before in hospital parking lots showing that things are quiet and there's nothing really going on here. Well, again, I urge people to really think for a second that the patients are inside of the hospital and not outside. For privacy reasons, people are not really allowed in patient care areas. And there obviously are a disproportionate number of cases in different areas of the world and in different areas of even our country. But, this virus, it's a novel virus. We're still learning a lot about it. And unfortunately, until we have a cure with a therapeutic or a prevention with a vaccine, does not seem like this is something that's going to be going away anytime soon. That being said, what we have to do is we have to let science lead and follow science to find what's the safest and best way of dealing with this in the short term and in the long run. So right now, a lot of states have been doing sheltering in place, and a lot that has helped tremendously, in the healthcare systems. I can tell you, not only we always talk about this as physicians, that, you don't want to overwhelm the healthcare systems. And the reason for that is not just because, it's a burden on the healthcare system itself and the people that are in it, but it also has a direct impact on the health of the patients. So if we run out of supplies, if we run out of tests, kits, to test people, if we run out of ventilators, if we run out of medications to give, then that's going to affect that patient's health, and it could lead to mortality. So that's the reason why we want to do that, and by the simple fact that if we just stop spreading the virus, that's less people getting ill and less people dying. So ultimately, it's all about saving lives. So these measures have really, really helped tremendously. But it's going to be a very fine balance as things open up. And people are really going to have to be, cautious. Everybody should really be extremely cautious, continue with the, hand hygiene, frequent hand washing, masking, universal masking. Really, once we found out that the virus is transmitted essentially by asymptomatic people, essentially by talking, that's when masks started being recommended. So you want to continue to do that. You want to continue to maintain your distance of 6 feet and be cautious. Again, you can't live your life in fear, but I think that the main thing is that you have to assume that anybody that you come into contact with could, have the virus, or could be harboring it, could be incubating it, may or may not become symptomatic. So if you are doing all these things, that should limit the amount of exposure, and protect you, protect your loved ones, your friends, your families. And these are challenging times, and we're going to be navigating, we've been navigating through uncharted territory, and we're going to continue to do that one day at a time.
You mentioned even by talking.
Yes. Yes. So, it is transmitted, essentially when we found out that asymptomatic people can transmit the virus, what that usually means is because with coronavirus, which is a very common respiratory virus that's been along for a long time, and, as SARS-CoV-2 is a new strain of it. The most common ways that these are transmitted is with respiratory droplets. So we often think when people are sick, when they're coughing and sneezing, that they can then transmit those droplets. And, if it lands, on a surface that somebody then touches and then touches their, rubs their eyes or their mouth or their nose, then they can contract the virus. Same thing if those droplets land on you as well. That was known for the symptomatic patients, but we know that the virus is being transmitted by people who don't have symptoms either. So what we've learned is that, even something such as talking, especially at, louder intonations, for a prolonged amount of time, there have been studies that came out early on out of South Korea that showed that there was an outbreak within a church because there was a choir there, and the people that were transmitting the virus were singing. And so, so this was also reported in Washington, with a choir there as well. So we know that the infection can be transmitted by this mode. So that's why the masking, helps contain those droplets and prevent further propagation.
So if people have some delivery coming in, and so taking a person delivering or post person, for example, person who drops mail to my home, he never covers his hands or his mouth. I don't know if anybody is refusing to provide protective equipment to postal service people, but he just goes around. So once I requested him that I think for your health, you need to cover, and he just shrugged it off. So while I'm talking to him, and if his particles of his saliva somehow reaches me, I could be infected. So this is a area where not many people are focused on, I think.
Yeah, I mean, that's essentially why we keep promoting the 6 feet of distance for exactly that reason, because these droplets can't travel that far. So that's why we always say, maintain that 6 foot of distance. And that's why we always say hand hygiene, because we know that washing your hands, that soap kills the virus. The outside of the virus has this lipid layer, and the soap can break that outside layer. And so, when you're getting your mail and you're going back in the house, the first thing you should do, first of all, discard anything that doesn't need to come in the house, and then wash your hand thoroughly for 20 seconds at least. And, just be cognizant of that. So, we say this frequently, that the mailbox, can be contaminated. There's so many different people touching that. So when you're touching that same thing after somebody else has touched it, you can come into contact with those infectious droplets, and particles. So again, hand washing is really key in all this.
So essentially, the virus is being delivered to your home in some sense.
I mean, it can happen. We don't know. There's no way of knowing specifically, but that's why we're telling people to be diligent about hand washing.
So in our family, if a mail comes in, you have gloves on and you take it and they leave it next to the door and open it, I think, in 2 or 3 days. Is there any logic behind all of this?
I mean, so there have been studies that have shown that the virus can be on different surfaces for different amount of times. The challenge in some of that is that although viral particles can be found on surfaces, that doesn't necessarily correlate that they can be infectious. So, the best thing to do, like I mentioned before, is, the gloves is, a good way of, starting that process. But then you have to also remember that not to touch your face while you're wearing those gloves, because sometimes that can give people that false sense of security that, oh, my hands are protected, so everything is fine. But then you touch the mail and then touch your face, and there you go, you just contaminated yourself. So take the gloves off, wash, and like I said, after handling the mail, just wash your hands. I think that's the best approach.
So some people, one person has asked this question on our Facebook feed, that how to deal 1 month old baby, must be by some mother.
So the question is on how to
That
care.
how to take care of 1 month old baby. Probably the person is infected or not infected.
So if the person is infected, we always say, this is definitely a challenge when people are at home, because, it's hard to isolate, that infected person from the rest of the household when you're dealing with an infant. So we always say that the person who's infected should definitely be wearing a mask. Again, that's really going to lower the transmission rate significantly, because it's containing all those droplets. And hand washing, we always say that before and after, every time you're handling the baby, just wash your hands frequently, wear that mask. All of these infection prevention measures will really help.
So you being visible Muslim, I have some questions in that regard. There was a study at the University of Chicago a couple of years ago that 50% of Muslim physicians mentioned that they felt discriminated in the system. And if I remember my numbers right, close to little over 10% of the physicians also said that the patient declined to be served by a Muslim physician. And one physician whose home I was staying told me a story that a patient, he was in a small town, he was the only cardiologist. And a case came, and this person absolutely refused to be treated by this quote unquote red, I think it's a raghead person or something like that. And finally, his wife was able to convince him that there is nobody else to save your life at this moment. So New York has 10% of all physicians in New York who are saving lives of people right now are of Muslim heritage, are Muslims. And some of them are more visible Muslim than others. So what has been your personal experience? I hope in this pandemic, people are not that discriminatory, but what is your overall experience with this? I mean, I know there are a lot of good people out there as well. I have chaired Parliament of the World Religions, and I was chair in the Salt Lake City in 2015 Parliament. I receive nothing but love from people. So there are a lot of good people in our society, but there are some of those. So have you encountered any of those things?
Absolutely. It's so interesting. So a lot of times, what I find more common in my personal situations is that a lot of times people will have a preconceived notion. They'll, judge a book by its cover. So oftentimes I'll enter a room and, there's several things that happen. So first, they see a female and they see a hijabi, so lots of different things are already happening in their mind. But a lot of times the first thing I'll hear is, "Oh, hold on a second." They may be on the phone and say, "My nurse is here," or they'll say, so it'll start with that, or they'll just have this look of not horror, but just I don't know if they're scared or what it is, but there's always a certain look, and then I'll start speaking, introduce myself, and then they very, very quickly feel relaxed. And the first comment a lot of times that comes out is, "Oh, you don't have an accent at all." And that's very, very common. And I think they feel at ease, once I start talking to them and I explain to them and I said, "Oh, that's because, I'm American like you." And, we start talking and, and then they feel more comfortable. But obviously there's certain people that you can't, change their mind. And, I always believe in, just show them kindness and hopefully, you'll be able to change their mind eventually. Every encounter that they have with a Muslim American should be a positive encounter so that, it negates any negative thoughts that they have in their mind or any preconceived notions that they may have had. Currently, in this situation, there's been, really none of that. But I can say that personally, I've been, alhamdulillah, really fortunate living in New York because of the diversity that we have here, to not have too much of that experience in the healthcare setting. But I can tell you that although things were not said, to my face, there definitely have been times where I've noticed there's been a discomfort in the room. There's been, a look and a judgment from a patient or a family member. And, I'll just try to work past that and, take care of them to the best of my ability.
You're watching Muslim Network Television. We are on Galaxy 19. If you have a satellite, we are also available on muslimnetwork.tv, as well as Facebook, YouTube, Amazon Fire, Roku, and pretty soon we will be on Apple TV. We're talking with Dr. Usma Sayed, and she is just amazing. She's mother of two children, of course, wife, and take care of her elderly parents. But she also has to go visit 3 hospitals. She spends 16 hours doing that. At the top of it, she teaches medical residents in her specialty, which is infection prevention, and goes to medical college to teach, goes to colleges and as well as high schools. I don't know how she does that, and that's what we're talking to. And she's not the only one. We have 10% of all physicians in New York hospital systems who are Muslim by faith. And New York has hundreds of police officers who are trying to save lives also. One of the person who was the Deputy Inspector General of the Fire Department, he was a Muslim with 4 children, a community person who passed away early enough. So are there Muslims who who are physicians in New York, or police officers and fire department Muslim? Do they network among themselves to deal with challenges of, especially you mentioned, I noticed when I asked you how as a Muslim physician patient take you, you say, well, first there is a woman walking in and then there is a hijabi, and they first start off assuming that you are a nurse and then gradually elevate you. So are there networks who support each other?
Yeah, so it's actually been really amazing in the last several years, mostly through social media. A lot of these networks have started, whether it be Facebook groups and then, social groups. But, there's a lot of different groups where physicians can, sort of have that support system. Right now, with the given state, with the current pandemic, most of us have been so engrossed in the actual patient care and have been dealing with our own, the emotional, physical, mental strain of it, that we haven't really had a chance to really decompress from it. But we do know that the support is there, should we need it, when we need it. And recently there's been, a huge support system from psychiatrists that have come together to provide, help for, physicians on the front lines as well, or even people that are just dealing with the mental health issues, anxiety from being in a pandemic. But it's always nice to have, support from people in the same industry, because, we're essentially going through a lot of similar things together. So, pre-pandemic, we would be able to meet and socialize and talk about these things. And now, we do it sort of remotely when we have the chance to.
Okay. And tell me this. If, I came yesterday morning, I came to know another phenomena. I found out two physicians I knew are laid off. I was shocked. I thought whole focus is on the industry and they need more patients. In New York, they were appealing if doctors and nurses from other cities can go and serve over there. So is that a known phenomena to you? So I asked them why. They say, well, hospitals need more people, but clinics and other services, they are laying off people. So physicians being laid off, I mean, I know that it's a huge phenomena. This morning news is 36 million people are out of job. So what is happening in this your field?
Yeah. So, we obviously are in the thick of it. We're on the front lines. So, majority of our volume is in the hospitals. My group, we do have a thriving outpatient practice as well. But most people, what we're doing now is we're doing telemedicine to see some of our patients. But majority of our patients are in the hospital, and our patients that are home, are relatively, healthy. So that hasn't been an issue. But I can certainly see where that's affecting so many private physicians who are not hospital based, like other industries where people are having difficulties where they don't have the luxury of working from home. I can see a lot of industries have adapted, and this is a new normal, and we're seeing the transition. It's really interesting to see. In the medical field, a lot of people are doing telemedicine, and it's been fantastic to see primary care physicians, cardiologists, pulmonologists, even psychiatrists taking care of their patients, virtually with telemedicine, and that's been great. But it's unfortunate if there's more and more people that have not been able to do that successfully, and whether it be that they're not, they don't have the right support system to do that independently, or whether they're part of an institution. I'm not really sure. Only time will tell once we have all the data on that. But we are seeing a drastic shift, not just in the general population, but even in the medical field, where we have the volume inpatient in the hospitals, but we're seeing the transition of healthcare to telemedicine as well. And it's been working really well for a lot of people, a lot of my colleagues, even for our patients. And we've been able to still provide care for our patients so that they don't, the important thing we want people to know is not to forgo their health care. It's really important, although we're in a pandemic, and they don't need to necessarily come to the hospital. We don't want them neglecting their health to the point where they're sick enough where they will then require hospitalization. So we need them to continue seeking health care and speaking to their physicians and being on top of their, health and whatever medications they may need refills on, and taking care of any urgent issues that they may have. And telemedicine does allow us to do that.
So, so many people we heard were avoiding going to see their physicians in hospital because they were afraid of getting the virus themselves over there. So telemedicine is a solution. How one should approach that? They should call their doctor and say, "Hey, I need to consult with you."
Absolutely. So first starts with the primary care physician. As I mentioned, so many primary care physicians I know are able to care for their patients with telemedicine. So you can start with that conversation with your regular medical doctor. And then if you need a specialist, they would be the ones that would be referring you to one. Or simply you can look within your network to find a specialist that you think you may need and just inquire if they're doing telemedicine. And I know, like I mentioned, a lot of physicians are, as we move forward, in our timeline, eventually, the offices will start opening up again, but everything will be modified. You're not going to have large waiting rooms with patients, loads and loads of patients waiting to see their physicians. We're not going to have that environment at all anymore. Everything is going to be modified.
Hmm. Are there patients when they are in hospital? Of course, the protective equipment should be available to medical staff, physicians, nurses, and other people. But what measures are taken to protect patients? Do they have masks also?
So patients are given masks when they come to the hospital, but the important thing is that the way that the hospitals are set up with the proper infection prevention protocols in place, we like to keep patients that are healthy in separate areas altogether, completely separate units, separate floors, where the staff is not intermingling, where the personal protective equipment is staying with the say whether it's COVID or any other type of infection. These are policies that we have usually in hospitals for other types of communicable diseases, and especially now with COVID-19. So we want to ensure the health and safety of all of our patients. And that's how we do that, by separating and segregating them in different areas and making sure that we continue our infection prevention policies and protocols that we had in place before, with the thorough cleaning and constant, evaluation of these areas.
One question which has come is about the travel. I know each city in each state has somewhat different things. That now Eid is coming up, and people are wanted to go and say hello and hi to people. So, what advice do you have for people who likes to go around and meet and see people? Is it still possible to maintain be 6 feet away from your loved one's home to say salam and Eid Mubarak, and maybe have a virtual hug? I was on a Zoom meeting with one of my granddaughter, and she jumped to her hand. We have a little play that I will grab her, and she'll try to pull her hand away from me. So she wanted to play that on a Zoom. So what do you recommend consideration for Eid? I know that it may not be very different, but I would like people to hear from you.
So it is really challenging. Our hearts, are just yearning to be with our loved ones, our friends, our families. And especially on Eid, this is not something that we're used to. We're used to just being fortunate enough to be around family, oftentimes all day long, and celebrate for so many days, especially at the end of Ramadan. But it is, the issue is the public health concern. And, I would say that as things ease up and the weather gets better, it's natural to want to go outside. It's natural after being in isolation, and sheltering in place for so long. It's human nature to want to just get back to normal. The thing that I would really caution people is that, we have to continue to protect those that are most vulnerable. You can't see the virus and you don't know who has it. And, the more chances of encounter and close encounter that you have with people, the more people that are at risk of, contracting the virus. And as we know, those that are elderly and those that are with underlying medical conditions are at highest risk. And so, it's really, it comes down to a matter of life and death. And, you don't know who's not going to do well. And we do know that people are not doing well, especially given that we don't have the cure or the prevention. So, I think it's better to err on the side of caution and be careful. And although it's not what we want, it's not what anybody wants, but, we have to think about the end result of all of this is, if these actions are going to have an impact on somebody's life, given that we don't have a magic bullet right now that's curative for this disease, it's a big risk to take.
You have worked with many task forces and many committees for infectious diseases. Well, thank you so much for your work. Being a mother of two, visiting three hospitals in this emergency situation of pandemic, it's a big commitment as a mother and as a physician. And so we're very thankful to you. Are we enough thankful to what World Health Organization doing? Are they beneficial to the work? Do you see what they do and what you have to do? Is there any connection? Because we have stopped their funding and China is increasing their funding. Are we losing as a country while this is happening?
I think, we have to be in tune to what's happening throughout the world. And when you have a great organization like WHO, who's doing so much for the rest of the world, just like I mentioned before, the elderly, those with underlying medical conditions or immunocompromised are, most vulnerable. We have to think the same of people throughout the rest of the world. We have to protect those who are most vulnerable. We're struggling in developed countries such as ours and in Europe with this pandemic and this amount of infection and the amount of mortality that we're seeing. Being in a developed country, you can only imagine what the equation that's set up there and what's potential for the undeveloped nations where people don't have access to clean water, where people don't have access to food, and where their supply chain gets completely interrupted when countries shut down. So there's so much good work that's being done, and I think we have to continue to support organizations that are doing the work, and develop policies and protocols for our own nation and for others as well.
Well, thank you so much, Dr. Uzma Sayed, for all the work which you do, and salute to all the physicians and nurses and medical staff in New York. Many of them I know have been infected and are touched by the virus, but that's a commitment to life. And God Almighty has told us saving one life is like saving a whole humanity. So you are at the forefront. May God bless you. Please continue to do good work which you have committed to. Is really that oath people say doctors have to take. Do you really literally take that oath, stand somewhere and recite that?
Yes. Yes.
Well, we will say amen to that. Thank you so much. I look forward to having you again on our show.
Thank you.
We have been talking. This is Malik Mujahid at Mujahid Talks. We are talking with Dr. Uzma Sayed, and we just thank her for her contribution and being with us at a busy time. You're watching Muslim Network television. We are on Galaxy 19 satellite and also on muslimnetwork.tv, as well as Amazon Fire, Roku, and pretty soon going to be on Apple TV as well. Thank you so much for watching, and stay tuned. We will have amazing programming coming up. On Eid Day, we will start at 9 a.m. Eastern Time with a virtual khutbah with all of us together saying Allahu Akbar, La ilaha illallah, Allahu Akbar, walillahi alhamd. And then we will have you pray at your home together and then listen to virtual sermon. And from 10 a.m. onward, we have special programming. Muslim singers with their songs, Muslim comedians with their comedy, and special children programming for Adam's World at muslimnetwork.tv, also on Galaxy. So thank you so much for watching. Peace be with you. Assalamu alaikum.